Welcome to Unveiled Radiance, podcast to help you strip away fear of aging. Hello, I'm Dr. Natalya, licensed naturopathic physician, aesthetic expert injector, and owner of Bloom Skincare. In each episode, we will discuss everything about skincare, strip away confusion about aesthetic medicine, and help you deeply understand what happens in your body as you start aging. We will invite expert opinion and, of course, science-backed information to help you deeply understand you. This podcast is part of educational platform called Unveiled You, which I designed for women just like you to help you understand everything, not just about your skin, which is your largest body's organ, but everything that's happened to your body from puberty all the way through past menopause, and enjoy and embrace every stage of that beautiful life. Let's get started. I am Natalya Borokovsky, and welcome to Unveiled Radiance. Hello, Unveiled Radiance listeners, and here we are with another episode, and this one packed with so much. It's a topic that is really close to me. It's something that I want every woman to deeply connect to and deeply understand. So for this conversation, I brought in big guns. Well, actually, she's very tiny. Dr. Sarah Cummins. She has a Ph.D. in psychology, and she is packed with information. So what we're going to unload today on you is medical information about your hormones, and most importantly, connection to your mind, to your state of thinking and reflecting of who you are for the day. And this is obviously not a medical diagnosis. We're not trying to prove you there's something wrong with you. Quite opposite. We actually just want your body to connect to your mind and most cohesive, self-accepting, nourishing way possible. And arming you with this medical information is giving you power, giving you permission to breathe and to accept the days when you do feel maybe a little off and a little blue. Because listen, being a woman, sometimes it's kind of a tough thing to do. So before we get into this whole nitty-gritty things, I want Dr. Sarah to talk to us about her, who she is, what is she focusing on, and what is her passion.
Thank you so much for that, Natalya. I'm so delighted to be here with you. This is such a passionate project for me, drawing advocacy and awareness of these hormones that are just wreaking havoc. They can give so much joy and love to our life. They can give us a lot of sense of appreciation, self-compassion. But more often than not, we can find ourselves with that inner critic speaking so loudly, so cruelly to ourselves, and the hormones are often at play. So I love being able to have this conversation. Thank you so much.
Yes. So before we get into this talk about hormones is such a broad topic, right? Specifically here, we are referring to sex hormones. For women, it's estrogen and progesterone. Those are main players, and they fluctuate throughout the day. Even for women who already went through menopause, they're still having some cycling, some burst of progesterone and estrogen excreted by their adrenal glands. But for women who are cycling, the younger women, that's when all this fun dance starts with the hormones, right? They rise and then they drop, and then other influences to those sex hormones are cortisol, which is our stress hormone, and then we have a little bit of a testosterone as well. So we will talk specifically what each of those hormones can do to our mood, why we feel certain ways absolutely normally without extra stress and extra problems in life. We're still going to have those slight fluctuations. And the most important thing I want to say about steroid or sex hormones, they are extremely powerful molecules. And I think a lot of people don't understand that our cells and our body is very selective of what it wants to absorb. So every molecule that you eat, you consume in any kind of way, it needs a receptor or a kind of a gateway to enter the cell. And sex steroid hormones do not need that receptor. I always think of them like a little bulldozer. They go straight through cell membrane, and beyond that, they go straight into a nucleus. They go into your DNA, and they truly change of what your cell does, how it functions. So think about the craziest change in your life, puberty. Hello, this is it, right? So your body completely changes from little innocent girl into all of a sudden young female, and that's a matter of maybe a few months. So that's crazy power steroid hormones have. So let's unpack it. Let's talk about it. So what happens during the cycle of what women expect to feel when their hormones naturally fluctuate? So it's before we even talk about the disease, Sarah.
Yeah, before we even talk about diseases, hormones in general, you are going to have your follicular phase. That's going to be those first few days. It very much depends on how long your cycle is. Standard protocol, like we like to say 28-day cycle, that's not true. For me, it's 24 days pretty consistently. For others, it might be you only ovulate actually twice a year. That's my mother-in-law. There are a lot of different fluctuations in our hormones. So what does this mean? It means that the amount of hormones you're going to be experiencing during certain parts of your cycle will inevitably dictate how you see yourself in the mirror, how you're feeling inside your body, how you're socially interacting, how your cognitive function is able to be right on point or a little bit slower, and how we just overall are able to express ourselves. So during that follicular phase, you might experience that you're having a lot more ability to control your mood, feel a little more what we would call stable. And then when you get to that ovulation zone, that's the sweet spot where progesterone is right where we want it to be for most individuals with a uterus. Having that progesterone right at the perfect sweet spot is ovulation time. You have the stable mood, even a little more happiness, a little more ability to maybe process your dopamine and your oxytocin levels. You're able to sleep a little bit better. So that mid-cycle point, which again, it's different for everyone, but it's usually right in the middle of your cycle when you're ovulating, that's when you're going to maybe have the best part of your month, or if it's a longer cycle, the best part of your hormonal fluctuation cycle. Then for some individuals, they enter into the luteal phase. And for some, it can be still okay for the first week, even leading up to your menstruation happening again. But progesterone, although it's going higher towards that ovulation time, it can start to fall. And it can start to be so that you are having a little bit of rage. You're having a harder time falling asleep. You're having the mood swings, irritability, all of these different aspects of our hormones fluctuating as we leave ovulation and get closer to the end of the cycle, to the start of menstruation. That can be a hard time for individuals. I like to show also the analogy of estrogen being the hormone we call it for universal female is estrogen. But really, I think to myself, it's the progesterone that matters so much, because the interaction and the balancing of the estrogen and the progesterone, as well as testosterone, we all have it, that's really what it's about, finding that balance. So estrogen is one of those things that we can hear like, oh, I need more estrogen. We hear that a lot for people approaching menopause and saying we need more estrogen. But it's interesting because conditions such as endometriosis, it's estrogen dominance. It can lead to some issues. Estrogen also can be very much linked to things such as having some intolerance to histamine. So histamine, meaning that you have maybe more prone to allergies, and having a high histamine level can be correlated with your estrogen level. All of these different aspects of our hormones are very much tied into our gut, into how our digestive system is handling our day-to-day lives, the foods we eat, the stress levels we are dealing with. This very much depends upon our estrogen and our progesterone and all of our hormone levels. And then with the neurodivergence, just to throw this into the mix, because this is something I'm passionate about, I think this is important for people to understand that people who are neurodivergent, which the most common ones we think of are ADHD and autism. There's a lot of us out there, myself included, having ADHD and autism. This neurodivergent piece means that we are likely to be more sensitive to the hormonal fluctuations. I think introducing that into the conversation right away is so important for people to understand. It's already hard to deal with fluctuations in our hormones as a woman, as someone born with uterus. We have a lot of monthly changes in our cycle, but knowing that there's also a cognitive, a neurobiological piece to it as well, that if you are someone who is neurodivergent, ADHD or autism, you might also be more hormonally sensitive. So the fluctuations throughout your cycle with your hormones might be more challenging for you than even somebody who is neurotypical.
Yeah, that's such a powerful conversation. I think the most important thing here is the balance. And unfortunately, so many women do not understand what that balance should be. And the balance between progesterone and estrogen, I always think about it as like a yin and yang, they all complement each other. And many women going through perimenopause, talking about women of my age, for example, right? So we are going through perimenopause. You're absolutely right. Most women think, oh, I'm becoming estrogen deficient, so I need more estrogen. But the truth is completely opposite. What happens as we enter the perimenopause, we stop ovulating, so your progesterone goes down. Your progesterone extremely deficient. And progesterone specifically, if we are talking about the brain health, it's closely linked to dopamine. That's the hormone that keeps us, I will say, relaxed and also keeps us satisfied with life, essentially, right? It's a hormone that gives you this kind of like a little burst of happiness. Like a good example for dopamine, I always tell people, like if you love chocolate and you have that piece of chocolate, you get that moment of dopamine burst. So that's why dessert's so addicting to women. And typically when our estrogen starts to drop down before menstruation, I'm sure a lot of female listeners right now will agree with me. That's when you start craving sweets. You start wanted a piece of cake. You want that piece of chocolate. You want to order an extra dessert at the restaurant. So knowing this about yourself, you have to allow your body a room to breathe. Also, you can start to recognize those patterns. And also, I absolutely agree with you that moment of ovulation, it is important for females to track their cycle so that at least they know where they are in the cycle. So the moment of ovulation is the most powerful moment for a woman. So if you are making some kind of business decision, if you are doing an important presentation and somehow you have an influence when you can deliver it, do it at the time of your ovulation, because that's when your estrogen, your progesterone starts to rise. Estrogen is at the peak and your testosterone is at the peak. And testosterone gives you that assertive power. It gives you that more of a linear thinking, something that you almost stepping into more of a masculine assertive role. So for something important like presentations or important decisions, that's obviously the time to shine. And it's typically the time when you love yourself in the mirror a little bit more. All of a sudden, all your imperfections and problems go away, and all of a sudden you look glorious and beautiful. The truth is, a lot of times you look exactly the same as you did yesterday, but your eyes see different things. Because the influence on your brain chemistry, as you already accurately said, it's so big by those hormones, estrogen and testosterone. You're starting to see yourself in a different kind of ways. So tell me a little bit about you. How did you arrive in this study? How did you learn this passion of endocrine and psychological connection?
Yes, I would say that I have always been an endlessly curious individual, and I've been fascinated by mind-body connections since I was young. I didn't have the language for it, but it was something that I always wondered, what is going on inside my bodies? Why is it that some days I feel numb, or some days I feel extra sociable versus other times I'm very introverted? And I was always curious about how those mind-body connections were impacting my health, how often I got sick, how often I'd have allergies, why some months my period would be more painful, why sometime mid-period, ovulation time, I would be having more pain during that part of my cycle. And so for me, it was actually a culmination of being curious about wanting to understand the brain and how the human brain is conceptualizing our existence, because you are the only person inside your brain. And knowing how powerful it is to have your self-perception impacting how you show up in the world. So this was always something I really wanted to tap into. But what actually triggered my launch into psychology was right after my 27th birthday, when after 10 plus years of knowing I had pain since I first started menstruating, but didn't have an answer for it, and advocating for myself with doctors and them saying, well, we just don't know. It's just your period. It's normal. I finally ended up in the ER right after my 27th birthday because of the worst pain I had ever experienced in my life. It was searing, hot, radiating, pulsating, stabbing pain. I was doubled over. I also have high pain tolerance, which, by the way, is linked to neurodivergence as well, especially autism. I don't perceive pain as easily as others. And so it actually took my partner telling me something is wrong. We are taking you to the ER. And as I'm writhing in pain, curled up on the bed, I said, no, I think I just need to get through another hour. But thankfully, he was smart enough to take me in. And that launched me into my world opening up into being validated by doctors for the first time. They opened me up because they assumed something is wrong with maybe your appendix. But when they actually opened me up, they found out that it was my ovary that had swollen to 10 times as large as it should be because my fallopian tube was twisted around my ovary and it became necrotic, which means it died. It was cutting off blood and oxygenation, and therefore my ovary was swollen and it just died. So they had to take out my right ovary. And when they did that, they saw all the endometriosis living inside my body, from the rectum to the vaginal wall, along the intestines lining, on the bladder, obviously over my uterus, my ovaries. This is a very common narrative that people born with a uterus, women, they don't often know that they're living with these growths inside their body that are dictating not just physical pain, but things such as having irritable bowel syndrome type symptoms. That's very, very common with somebody dealing with endometriosis. Usually that diagnosis comes first before an endodiagnosis. It comes with mental fatigue and exhaustion, cognitive issues of just not being able to think clearly, the brain fog. It comes with painful sex a lot of the times. Why? Because you have growths called adhesions and lesions. There's scar tissue in there as well. So penetration and sex can be painful. It impacts your social lives. It impacts how you show up with friends, how you go to school and work, because of not just the pain levels, but how your mental health is impacted. And for me, being somebody who was higher pain tolerance, I could handle the pain. I could not handle my inner critic and the feelings of anxiety, depression, and also such things like my gut being so disturbed, so disrupted that I was in pain and was not having the kind of health that I needed in my gut. And these were things I just didn't know. Getting the diagnosis gave me the validation externally from a medical professional. And it actually allowed me to say, okay, well, now I know what is impacting not just my physical health and every time I have a cycle, but also what's happening with my mental health, how I am perceiving myself when I look in the mirror, how I am perceiving others and what they think about me. And one of the most important things to understand for anyone going through a chronic endocrine condition, which could be endometriosis, polycystic ovarian syndrome, premenstrual dysphoric disorder, even Hashimoto's thyroiditis, all of these different conditions, they come with a level of isolation, of feeling lonely, of feeling misunderstood, of feeling a lack of validation. And that can be the most painful part of the condition beyond the physical. So for me, I realized I don't want to go into the medical field. I want to go into psychology. I want to find out what this mind-body connection is. And I want to advocate for people like me to find self-care strategies and self-management practices that work every day. Because doctors save lives and they do incredible things, yet they can't be with us every day. And they don't know our bodies. We are the only ones that know our bodies. So being able to encourage, educate, and empower people through empathy to be able to trust their body's inner wisdom, that is my greatest passion in life. And that's why I went into psychology after my diagnosis.
Oh, this is such a beautiful, vulnerable story you shared with us, Dr. Sarah. Was really kind of you. And I think speaks to a lot of women. And that's such an unfortunate truth that many women with endocrine disorders, especially in the young teenage years, become dismissed by the doctors, not because doctors don't care, but we are lacking research on female health, specifically on reproductive health. I mean, yes, we do have a lot of research in obstetrics, right? In pregnancy and baby's delivery, at least we know that sometimes could be very life threatening for women. We learn how not to let women die now in childbirth. But thinking about our ancestors not that long ago, just hundreds of years ago, how many women have died in childbirth because we didn't know. And unfortunately, truth is, and also me going through medical school, I know most of the research we have and most anatomical studies we have to this day are on male bodies. So now finally our medical society is waking up. We're starting to study female bodies. We're starting to understand so many common disease symptoms present completely different in female bodies. We feel pain differently. We have a different symptoms. Our pain radiates into a different pattern. So a lot of times it becomes undiagnosed. And I'm so sorry you went through such a painful experience, because having swollen necrotic tissue, it's kind of like something similar to testicular torsion. If there's any males listen to us right now and any of them have heard of, or for goodness sake experienced testicular torsion, they know this is absolutely retching pain body experience. And what you went through is virtually exactly the same. And it's very unfortunate you have lost one of your body pieces, very important ones, but so wonderful you actually woke up and created something beautiful out of this experience. And now speaking as an advocate for women, helping them understand. So let's kind of dwell in there and talk about brain connection patterns when that happened, right? So for women, one of the things that's very common theme for people who experience PCOS and endometriosis is estrogen dominance, right? We already use that word. So let's dwell into it and explain why that happened. So essentially, body does not ovulate properly like it should for whatever different reasons. It could be mechanical obstruction, like it was in your case of the fallopian tube. But when body does not ovulate properly, then progesterone does not rise properly. And then estrogen goes unchecked and it continues to increase. And ultimately, for simplicity, the job of estrogen is to make things grow, specifically to grow uterine lining, preparing female body for potential pregnancy. And the job of progesterone is to increase blood flow to that uterine lining and to sort of make it goopier, juicier, if you will, right? So that heaviness of a thickened uterine lining creates menstruation if the pregnancy doesn't occur, and then it's naturally sheds. So when progesterone does not rise as it should, this tissue continues to grow, grows unchecked. So it's almost like weeds, if you will, right? If you don't take care of them, they continue to spread through your entire garden. And that's how endometriosis occurs, because it's essentially uterine tissue that just kind of jumps outside the uterus and starts to go like a haywire all over the body. And the problem with it, because it is invading tissue, it's there where it doesn't belong, it creates a lot of symptoms, and it also suffocates, affects the organs surrounding it. And it could be really anywhere in our peritoneal cavity, which is your abdominal cavity, right? It can affect your intestines, it can affect your liver, all the major organs that are located there, and it will interfere with the function. So like, as you're saying, it can have symptoms of improper digestion, like IBS, and all the other things that follow. So let's talk about, before it gets that far, before it gets into the endometriosis, that estrogen dominance, how can a girl, let's talk about just starting to menstruate, going to puberty, how she can recognize those internal clues that maybe her estrogen is too high? What would you say to her?
I would absolutely tell her to start writing it down. And I know this can seem so simplistic and reductionistic to say keep track of what you're feeling, but it truly is the most powerful way for us to know what's happening during every part of your cycle, especially when we break it down to first day of menstruation, during that follicular phase, leading up to ovulation, and that little window there, that sweet spot. And then after ovulation, going into luteal phase, and how that feels for you. Because what I'm experiencing personally, my nieces in my life, the young women in my life, the people I have studied in my research writing my dissertation on endometriosis, they have spoken about how these symptoms, these expressions of how endometriosis and other chronic endocrine conditions can translate to mood shift, translate to how we feel as a person showing up in social life with our family, with our friends at school when you're young. These are the indicators early on that are important and valuable, and only you know what's going on in your head. And so I would tell, first and foremost, what you are feeling is real and it's unique to you. No case of endometriosis or polycystic ovarian syndrome or premenstrual dysphoric disorder is going to be the same. They are all different because we are all very unique. And when you have one condition, such as endometriosis, they often come with multiple others. So if you are, let's say, a 13-year-old, 14-year-old, that's typically a time when we start to notice an increase in pain being recognized. But what else is happening to you beyond the pain? We're taught from young age to listen to pain, which is important. But I like to come from the aspect of being someone who has a higher pain tolerance, who does have autism, low support autism, and ADHD. It means that I like to dismiss my pain. And I've done that since I was a child. And there's lots of layers we could get into that we don't need to in this podcast about why a child might dismiss their pain or not believe their body or their thoughts. But I like to say what you are feeling inside is absolutely valuable and it's valid. And you do get to trust what you are feeling inside. You do get to express it and tell your parents how you're feeling. Tell your friends. It's important. Share with your friends. It should never be something that needs to be hidden or dismissed and never to be embarrassed about. It is a part of our life. So from an early age, if you as a teenager or people listening who have teenagers in their life, if you can help them feel that empowerment to be able to speak, express the different mental and emotional health symptoms they are experiencing, and just get into the habit of asking, how do you feel when you're starting to menstruate or right before what we call typically the premenstrual phase, right? The PMS is a very common term. Now, we're told PMS is normal, but I think it's very important for people to understand that if you are having excess pain, bleeding, other symptoms like gut disturbance, maybe high nausea, some individuals will start actually to vomit because the pain is intense, because the symptoms are so severe. Those are very important symptoms to take note of and to be able to know one point in your cycle are you noticing them more. So I think it really is about making it a common conversation, something we bring up in any social setting to say, today I am having a hard time putting my words together. I'm having some cognitive issues, a little bit of brain fog, or today I am exhausted. I am so fatigued and I don't know why. Or today I am feeling really insecure. I'm feeling very lonely. I'm feeling like maybe everyone hates me. These are such important and valid emotions to feel. All emotions are good emotions. And I think that's also really important, especially for the young generation, especially for those born with a uterus, to understand early on, all emotions are important messages to your body, from your body and to your body. It goes both ways. And we always should feel that it is not only important for us to speak how our emotions are and to tell our friends and family, but also that gives them permission to reciprocate, to tell us how they feel. And that's how we change positive society. That's how we make it so that more research is done on these conditions. I think that is so important. I like to make the distinction that these are traditionally called sex hormones, but they're actually not just about sex hormones. They're in your brain. They're not just in your uterus or your ovaries. They are in your brain. A lot of your progesterone is in your brain. And it's actually the progesterone that is produced in your brain or that's up in your brain that's going to give you that sense of calm, that sense of steadiness, of being able to sleep well. So it's important, I think, holistically to view it as, yes, they are sex hormones, but it's way more than that. They're hormones that every part of our system, every organ. And I think it's important to know that, especially with the most recent studies on endometriosis is not isolated to your pelvis. It actually is found commonly now in your diaphragm, in your lungs, even in your brain. Endometriosis is almost like cancer in that it can spread and it can grow and it can be found in a lot of different places in our body. And why is that important? Because we need to stop siloing endocrine conditions to be just about having a uterus or ovaries or about sex, gender. It needs to be beyond that. It needs to be about human health. It needs to be understood that for some individuals with endometriosis, they might not realize they have it until closer to perimenopause, when it's gotten so severe that it's actually up in their diaphragm or lungs. This is a whole body condition.
Yeah, and you're right. It's so many of those women go undiagnosed just because we are taught to be silent. We are being dismissed for most of our lives. And then again, the PMS is normalized. And every single woman I ever spoke about her reproductive health, I always tell them and tell them their daughters and then all the other future generations, experiencing pain during menstruation is not normal. Little cramping, little kind of like a feeling of something happening there, that's normal. But to the point that you are skipping school, you cannot go to work, you have to take pain medications, that's not normal. And that absolutely should be addressed. It's your body communicating to you something happening that's not supposed to be there. So let's talk specifically about the brain chemistry, because often we bring up this, experience, you experience this, experience that, but it's important to name that because I know our listeners will be Googling it, looking at it and like, what are we talking about this? So progesterone, it's a very fascinating hormone. I already mentioned it is closely linked to dopamine secretion. It influences how dopamine is processed. And the dopamine is a neurotransmitter of kind of satisfaction and happiness in our brain. And the dopamine is actually far beyond that. And we did the separate episode with the other psychologist about dopamine. But for the simplicity, let's just talk about the hormone of happiness in this situation. And then most importantly, what gives that sense of calm, it's because progesterone controls GABA. So can you tell us about GABA? What is this? And then how can we know it's present in our brain or it's not? And if it's not, like what's other neurotransmitter that kind of starts writing up?
Yeah. I think that's so fascinating because this brings me into this idea of exogenous hormones versus endogenous hormones. So being able to understand that exogenous means that it's what's coming from outside your body. This would be hormonal birth control, hormone replacement therapy, HRT. If you're on an IUD, if you're on a pill, or if you are on HRT, that's exogenous. It's the replacement. So for progesterone, that would be progestin. And it is treated differently in your body, as in your brain and your gut are going to synthesize it differently. Now, for some people, they have intolerance to progestin. And for some, there can be an intolerance to progesterone, but more so it's the progestin, which again is synthetic essentially. It is the exogenous product that we're trying to replace when progesterone, which is naturally created in our body, is too low. So it is a balance of finding out what each individual can handle with their progesterone and how to boost those levels naturally if possible, and if they will handle using progestin as a replacement for hormonal replacement therapy. It's very much going to be different for each individual. So being able to use GABA as a supplement as well, you can also be able to try to boost your GABA production. And I think that that is so important for people to understand, especially as you're in perimenopause and menopause, because that is when we see that some individuals are going to need to have those extra nutrients, extra lifestyle modalities, extra assistance from their healthcare practitioners to boost production of progesterone, of GABA. But sometimes they are going to need that exogenous support of having progestin added as part of your routine. And sometimes it's a pellet where you can actually have your doctor insert a pellet to release the hormones. Sometimes it's going to be a shot you'll use or a patch you can use. This goes for estrogen or testosterone or progesterone or progestin. But to know how these all play in our brain is so important because it won't be the same for every individual. I'm a huge advocate for HRT. I think it's very valuable, and it's important for you to have a very clear conversation with your practitioner about how you're going to start, what levels you'll be starting at, and how you'll monitor it. And again, this comes back to just like I was recommending for young girls, young people with a uterus who are starting to menstruate, to take note of those symptoms you are feeling. It really comes down to you being able to identify what mentally am I dealing with during these hard times of my cycle, and physically, what am I dealing with, and putting it in a note and being able to take consideration into these emotions that are cyclical, that are happening at the same time every month, and bringing that information to your doctor so that they can be able to prescribe. Do you need to have something to boost your GABA? Now, do we want to try and supplement here? And another thing I think is so important we haven't touched on yet is serotonin. I think serotonin is an amazing way to be able to understand how our hormones go beyond just the reproductive sex hormones. Serotonin, 90% of it is actually synthesized, produced in our gut. So why does this matter? I think a lot of times we can think of our hormones as being located in our sex organs or located in our brains, which is true. But serotonin, 90% of that is in your gut. So actually, when we're talking about how do we produce our happy mood, increase our progesterone, our GABA, it's also a conversation about serotonin, I would say, because we can do a lot to help boost our gut health to be able to increase our serotonin levels naturally. So that is a thing I think gives a lot of power to people to realize that because 90% of that serotonin, which by the way is a happy mood hormone, it's stable mood, not like the happy high of dopamine, but it's actually a stable, calm, good energy. That's the serotonin that we synthesize in our gut. So what does that mean? We have a lot of ability to control how much serotonin is being produced, or just that we have a good balance of it. It's all about balance. By what are we doing to heal our gut? What are we doing to eat in ways that our soluble fiber is hearty enough? That's really important so that we can have serotonin levels stabilize. Also, that goes for estrogen, testosterone, and progesterone. What's happening in our gut, and how can we help increase our motility through our gut? Because that's how hormones are cycled out and flushed out, and that's how you create balance. So I think that's why knowing that gut health is completely tied to hormone health is a game changer for individuals to realize that we want to flush out hormones every day. That's through a bowel movement largely. So being able to have soluble fiber at the right level so that your hormones are flushed out of your system every day to create that balance that gives us that good steady feeling. That's what we also want to be very aware of, and that we have a lot of control of, is playing with our diet to figure out what foods are going to help me have a consistent bowel movement every day, because that will stabilize your hormones.
Yes, absolutely. And I think you touch on to something very important because it goes far beyond of your natural hormone production. It goes into hormone metabolism because specifically for conditions like endometriosis, estrogen dominance, the liver gets very busy processing all this excess estrogen. And that estrogen goes into some of the very toxic metabolic byproducts, which then accumulate and then amplify the effects of pain and other disturbances that endometriosis condition can deliver. Same thing goes for PCOS. And if since we are on the topic of hormone replacement and premenopausal syndrome, a lot of times when we start to tiptoe, our body starts to tiptoe into menopause, we go to that premenopause, our body in that estrogen dominance condition, because our progesterone already declines and it declines very quickly. So often women don't realize that they are in the state until it's too late and then start to experience heavy bleeding, pain. There might be some polyps, fibroids in their uterus. And, a lot of times women end up having hysterectomies at that time in life just because the doctors did not see it early enough. They did not see it. It was just a natural, normal body's transition. And it could be addressed and supported early without use of medications. And here's also a very important topic, as we were talking about serotonin, for example, right? We know a lot of people in our country struggle with mental health, anxiety, panic attacks, depression, and very often people get prescribed SSRIs and other supportive medications without truly understanding the havoc of those medications do to their body. So instead of just taking prescription and never truly addresses the cause of the state and why they end up there. Sometimes prescription is necessary to help women or individuals in general go through some kind of difficult mental state in life. Sometimes people live through some kind of traumatic event. They need the prescription to help them get through it. And it's valid, absolutely valid. But when people just get relied on prescription for the rest of their life, that's when I believe it becomes a problem. Because we know the very common thing for people on chronic SSRIs, they gain a lot of weight. And why? Because the digestion is disturbed, right? Because digestion, the serotonin is not functioning normally in your digestive tract as it should. So ultimately, that brings us into a very important part of this podcast. Let's talk about strategies and practical tips we can give to women specifically, because that's our audience, how to maintain healthy endocrine system, how to maintain healthy gut-brain sex hormones connection. What the simplest things that we can do for our bodies?
I think that the first thing we always need to talk about is how we talk to ourselves. Now, again, this can seem like, well, that's not health advice. Well, actually, it is, though. It's saying that the way you talk to yourself is going to be the energy your body responds to. And a lot of us with mood swings, with looking in the mirror and feeling dissatisfied, especially during certain times of the month, that can directly impact what we feel we're allowed to or worthy of doing for ourselves. So the first thing we must tackle is our inner dialogue, our way of viewing ourselves internally. And that is going to allow us to build a strong foundation to use self-care strategies to positively impact our hormones and our health overall, our immune system, reduce our stress, be resilient, and be able to thrive in life. So how we speak to ourselves, first and foremost, I encourage all of you to always slow down when you are having those moments where you feel dissatisfied in your body, or when you look in the mirror and you feel shame, or you think of certain situations like having a chronic condition, and that also adds to shame. Knowledge reduces shame. So when a woman realizes, oh, I feel more anxious today because my progesterone is higher, and for me, that's actually going to make me feel a little anxious, because sometimes that is the translation there. For some, right at ovulation, it's the calming, it's the perfect amount of all the hormones being balanced. For others, like I said, there can be a little bit of intolerance with progesterone. And for some, it can spike anxiety. So knowing that self-blame has no place in your life, and instead you need to embrace self-understanding. And shifting this can empower women to plan their routines, plan how they communicate with themselves and with people in their lives, and then to use self-care in harmony with their bodies rather than in conflict with themselves. So I like to talk about the shame and the self-worth first and foremost, because a lot of these hormonal conditions, which are chronic endocrine, they start with things like anxiety and depression. For some, it can even be suicidal ideation. These are extreme forms that can persist throughout the entire life cycle. You might go from your first cycle when you're, let's say, 8 now, some individuals, or 14, 12, and from that point on, you might deal with a lifetime of cyclical anxiety and depression and feelings of shame. So what do we do to build a foundation from early on, or at any age that you are, to say, I'm choosing to speak to myself with self-compassion? That's the biggest thing I found in my research when I was studying hundreds of cases, especially on endometriosis, but this translates to polycystic ovarian syndrome and all kinds of other chronic conditions, especially related to your hormones, is it's an issue of self-compassion largely, that the people in these studies, largely women, are able to say, I don't feel good in my body. And that makes sense. You don't feel good in your body. But how do we then translate that to, I'm going to have kindness on my body, going to have self-compassion? That's where we start. And from there, we can build in self-care strategies. And my dissertation was largely about what I called complementary self-care therapies, meaning what can you yourself do outside of medical intervention, or specifically outside of pharmaceutical and surgical, because there's a lot that we can do. Now, using self-care can mean using holistic and functional medicine practitioners, naturopathic practitioners. It means pulling in those resources to holistically look at your body and your mind to know how does that mind-body connection translate what you see in the mirror. And so being able to pull in, for instance, a holistic chiropractor, that is an amazing resource. Why? Because they are knowledgeable about your entire body, all the veins, all of the different ways our body is connected from head to toe. And they're able to feel things and explain things in a way that helps an individual with endometriosis or other chronic endocrine conditions, who's struggling with hormones, struggling with mood. A good holistic chiropractor can say, let's do some adjustments here. Let's do a little bit of compassion here on your body to help you be able to get to a spot where the symptoms are suppressed or lower. That can be a self-care strategy. There can also be things that we widely know about, such as yoga, right? For some, they love yoga. For others, they don't. It can be meditation. Again, it's very much a preference. Meditation is directly studied in all kinds of research to be very significantly impactful for all kinds of conditions. But for some people, they don't like the idea of meditation. What I found to be really helpful, especially with people born with uterus for women who are dealing with these hormonal conditions from endometriosis to PCOS to PMDD, is being able to try to activate that vagus nerve, which is a hot topic right now. But what I specifically like to talk about is vibrational activation. This can literally mean being able to move your body, just movement, bringing the conversation beyond exercise. It can be a word that feels restrictive, controlling. I love to encourage movement. It means move your body, because all of us have signals from our brain and from our body, even when you're dealing with pain. For instance, when I'm having endo pain, it's movement that helps. I just mean get up and I walk around, I bend my body, I do some downward dog, I do some gentle stretching. And more importantly, when I'm doing that, I'm connecting to my body and I'm able to understand, how is it feeling? I'm able to slow my body down so that I can tap into wherever I'm feeling pain or whatever part of me is having some mental health struggle. And I can visualize it and I can try to speak kindly to that part of my body. But I'm using movement to try and activate these kinds of self-care practices. And it can also be things that you can try, such as certain types of low inflammatory foods that make you feel better. It's always about what makes you feel better. It's never about diet in my mind. It's about knowing what foods make you feel better now and knowing that what works right now may not feel the same in a month or in a year. And so having that resiliency and that flexibility to every day check in with yourself and say, what does my body need today? Is it more of anxiety and depression that is at the forefront of my mind? Is it I'm having irritable gut issues, right? Like irritable bowel, or I'm having even urinary tract pain? What is it that I want to focus on? And just trying to figure out today, what do I need? There are endless amounts of self-care strategies to use. And that's why I think it's so empowering to just know what is going to feel good for me today. There's no right or wrong answer. And it's not about looking for external validation from a practitioner or from even a friend with the same condition, because it's really about knowing that your body has that inner wisdom. And if you tap into it, it means you're listening to what feels good in my body today. And that's really the power of self-care.
Yes, I absolutely love that. Everything you said, it so deeply resonates with everything I already teach. And that's what we teach in our Unveiled You courses. Our course Beyond the Mirror connects exactly to that. And I think that's where the healing path should start for every single woman. It's to teaching her how to talk kindly to herself. So far, it's been absolutely incredible conversation. I think we should bring you back because there are so many deeper topics we are tapped into, but really didn't fully explore. But overall, we hope that listeners enjoyed this conversation. We are going to put in all your contact information below the course in the description so people can find you. So when people do need that external support, they know who they can reach and they know where to go to ask for help. So thank you so much, Dr. Sarah. It was a wonderful experience, and I hope we'll see you again at this podcast.
Thank you so much, Natalya. I'd be honored to come back again.
Thank you for joining me on Unveiled Radiance. If this episode resonates with you, please share with someone you love, with another woman who might need to hear this information. And for full experience, head to unveilyou.life, where we share everything about skin, hormones, and even self-confidence. Until the next time, thank you for joining me, and please take care of yourself from inside and out.